It's quite possible, I'm not saying it's definite, but it's quite possible that the origin of that outbreak is someone who has been asymptomatic, maybe still infectious, or maybe not, but was infectious over the last 5 or 6 days, and maybe lives in another part of Sydney. Because we know from the Avalon RSL records that a number of guests that night were not from the northern beaches. So that's my main concern. Compare that with the Crossroads Hotel cluster, when the New South Wales Health was able to identify the source. There was a guy from Melbourne who'd gone up there very quickly. I think it was within 24 to 36 hours. Now, that hasn't happened this time. So that gives me considerable concern.
In New South Wales, do you think they're undercooking their response to this outbreak by not locking down or mandating masks?
Yes. I mean, I've been listening all day today to so many commentaries, and there just seems to be so much wishful thinking. You know, it contradicts what we've seen happen, not just in Australia, but around the world. Now, Patricia, I went back to look at when Melbourne was in a comparable situation. And that was June the 19th when we reported 25 cases, similar to what Sydney has reported in the last 36 hours. A week later, it was 40. A week after that, it was 100. And a week after that, it was 290. And you know as well as I do what happened there. And that was, according to the Chief Health Officer in Victoria, the time when contact tracing was overcome. Now, look, we've heard 100 times how great the contact tracing system is in New South Wales. I'm not going to contradict that. But that's not the only tool that we need to control an outbreak. And we've seen in countries like South Korea and Japan that have taken a similar approach, so really excellent contact tracing and isolation, that eventually they're overcome. Both those countries now are overwhelmed with third waves. So in addition to great contact tracing, you need the other precautions that we know prevent transmission of the virus. And that is social distancing, which is not happening in Sydney, and masks. You know, we know masks are as good as a vaccine that's 80% effective. And yet I just watched on the ABC TV scenes from Sydney Airport live where everyone's crammed into check-in queues and almost no one's wearing a mask. So I just think if masks aren't mandated tomorrow, then I think the Premier and the Chief Health Officer have to explain clearly to the Sydney public why that's not the case. They have never done that before.
No. Look, what should they be doing right now then? What's your view on how they should be handling it today and tomorrow?
Well, going back to the Victorian situation, on that, 2 days after that day, we reported 25 cases. We decreased the number of people allowed in a household from 20 to 5. The Chief Health Officer signalled that he would soon mandate masks, and there were travel restrictions within 6 northern LGAs. Now, northern Sydney has the advantage geographically of being basically cut off from the rest of Sydney. So I think a hard closure of that region would be advisable. Masks should be mandated. I'm tired of hearing the word should. We know from Victoria that when masks were recommended, about 50% of people were compliant. When they were mandated, it was like 99%. So people are not clearly taking that advice. And, I think it's way over time that masks should be mandated in public transport and other settings. It's pre-Christmas. People are packing the shopping centres. Now, Patricia, today I went to the Pran Market, which you would know, but your listeners may not. It's a fresh food market in Melbourne. Every single person was wearing a mask, and that's 49 days after we last reported a case.
Yeah, that's right. Look, there's been a huge cultural shift in Melbourne because of the mandating. There's no doubt about it. I too went through the shops today and I was completely masked up. I was not taking any risk transmitting or getting any virus during this period. I don't want that thing near me, and lots of people don't, because we know the horror that it unleashes on a community. Look, what do you anticipate over the next week? Because there are different responses from states shutting down borders or restricting movement in some ways. We hope to be opened up by Christmas, but that looks incredibly shaky right now.
Yeah, look, as you know, I've talked to you a couple of times. I've never been strongly in favour of closing borders, but I understand now why the states are acting as they are. And we have the example today of Queensland, of someone from the Northern Beaches who somehow got up there on a flight, and probably hardly anyone in the flight was wearing a mask. So I can understand that. But going back to your question, I think, the principle I've been following is when you have a cluster like this, act fast, act hard. And that's not the case at the moment. It's a lot of shoulds and advice, but really nothing that you could classify as hard, even compared with the Adelaide outbreak, where they did go into an immediate lockdown. I'm not saying that should be across Sydney, but I would do it in the northern suburbs. Otherwise, people are free to travel around Sydney. No one's going to stop them at the Spit Bridge. Maybe they should. So I think the action has to be much tougher, and it has to happen now.
Yeah, well, let's hope that they can get it under control. Thank you so much for joining us.
Thank you, Patricia, and it's been a pleasure to talk to you this year. And have a great holiday.
You too. Let's hope we've got less to talk about next year. Although,
we can talk about something else.
I don't know, just the weather or something. Professor Mike Toole is an epidemiologist from the Burnet Institute. I have a feeling we will be speaking to him quite a bit next year, and thank you to his time.